My name is Beacham Grijalva Prieto. I'm 21 years old and I live in Arcata, California. There are a lot of beautiful things about Arcata. We have the forest right here, but we also have the ocean a couple miles away, and it's a really beautiful place. By contrast, Arcata has a lot of issues with access to healthcare in terms of the quality of healthcare. I call Arcata a health desert because if I don't feel comfortable with a physician, it's been a little difficult. You know, you can try to say, like, I don't feel comfortable with this person, but it's likely that they're probably the only person in their department. I'm a student at Cal Poly Humboldt studying psychology. The school did let us know that there may be some difficulties with getting services, but I wasn't aware that getting labs, seeing a specialist, even routine stuff like getting dental work done, that's really important. It can be a very long wait, sometimes up to 6 months. Not being able to access care as a student is very daunting. We're young, we haven't really had to deal with medical documentation and billing and stuff like that. This is all a new world for us. If we could make one step, the actual accessing of the service, easier, it would put a lot less stress on us. Telehealth has really addressed a lot of my needs. Living up here in a rural area, it was being offered at our school now for the mental health area of our clinic.
So how are things going?
I meet with Elise, she's my therapist. She sees me as a person and is very interactive.
So a lot of shifts in positive directions over the last couple of weeks. How would you say you're
A lot of students talk about needing therapists up here, and they're students of color and they feel that they can't really go to the therapists that are here because they don't have the cultural experiences that they do. The people who are typically in this area who are healthcare providers are typically white and straight. I think there could be more choice on telehealth. It could bridge that gap of healthcare access with diversity. If I could have some kind of portal where if I needed some kind of specialist to talk to, it wouldn't just be from this area. It could be someone from San Diego or even from like even lower part of SoCal. Being able to open our choices up to a much broader area would be nice. In terms of bettering telehealth, I think a hybrid approach would be best, where we do a pre-screening online where we can talk about our symptoms and then our physician can take that in, take some time to do their research about that, and maybe come back later to maybe another follow-up video if that's what the doctor decides is best, or an in-person. It's a lot less time-consuming and energy-consuming for me personally. In terms of telehealth in the future, I think so far it's been a very useful tool and very helpful. If we could find a way to get telehealth to be kind of just this broad, universal thing where no matter where you are, if you need care in this second from, like online at least, you can get it. That would be really nice.